Welcome, everyone. I'm Meredith Beaton-Starr, and I'm so excited to be moderating today's breakout session, Interprofessional Team Workshop in an Integrative Medicine Clinic, the Migraine Toolbox. Joining me on this panel are my colleagues from the Osher Center for Complementary and Integrative Medical Therapies at Brigham and Women's Hospital in Boston. Dr. Matt Kowalski, chiropractor, Dr. Carolyn Bernstein, neurologist, Lindsay Keach-Bronstein, nutritionist, and Fan-Roche, craniosacral therapist. I'll start by way of introduction. In 2003, a group of Eastern and Western practitioners, including a neurologist, 2 acupuncturists, an orthopedic surgeon, 2 primary care physicians, a craniosacral therapist, a rheumatologist, a psychiatrist, 2 chiropractors, an occupational therapist, a physical therapist, a nutritionist, and a nurse, along with a medical ethnologist and a group facilitator, met for 8 hours a week for 12 weeks as part of an NIH grant to study a multidisciplinary approach to pain management. Our team learned so much about our respective disciplines, and we went on to design, run, and publish a successful pilot study treating patients with acute back pain at Brigham and Women's Hospital. Over the next 4 years, we created a virtual clinic where we referred patients to each other in our respective practices. In 2007, we opened the Osher Clinical Center at Brigham and Women's Hospital and got to put these lessons in multidisciplinary treatment into care and practice. The majority of our team is still working together in this practice. Dr. Kowalski, G, and myself were part of the original group. Dr. Bernstein joined our practice in 2015, and Lindsay joined in 2017. Since Dr. Bernstein is a neurologist who specializes in migraine and headaches, we started seeing many of her headache patients in our practice. I'm an occupational therapist and have experienced firsthand how treating patients in groups can add value and improve patient outcomes. Dr. Bernstein and I discussed the idea of a multidisciplinary group to treat headache patients, and we met as a team to determine which modalities lent themselves best to this kind of practice. In 2016, we started a group treatment program called the Migraine Toolbox. Our group meets for 3 1.5-hour sessions over a 6-week period. We have run more than 30 cohorts of this group, and I have to say it improves with each session, mainly due to my talented colleagues and as well as feedback from patients. Each of us today will present in brief the work we do in this group, and then we will open up a discussion about our interprofessional team approach. So for me, as the coordinator of the program, it's my job to communicate with, welcome, and orient our patients in session 1. This first session focuses on education about the impact of stress and lifestyle factors with migraine, including sleep, anxiety, exercise, work and family, and learning strategies and coping skills. Patients learn mindful breathing, the relaxation response, and practice some simple yoga poses. This work is hands-on and dynamic and lays the groundwork of what's to come in sessions 2 and 3. A popular section of session 1 is Migraine 101. I call it everything you ever wanted to know about migraines, answered by a world-renowned expert, Dr. Carolyn Bernstein. This gives patients a chance to learn about the latest in migraine therapies and treatment and ask questions in a supportive and comfortable setting. So with that, I'd like to welcome my colleague, Dr. Carolyn Bernstein.
Thank you, Meredith. I'm glad to be here and talk today and tell you a little bit about my part of this wonderful group that we've all worked to put together for our patients. Migraine patients have a profound sense of isolation with a chronic illness that's episodic and incurable. The group brings them together not as a support group, but as an educational process to learn different factors that might help them to be more motivated and in charge of their own healthcare, and we've gotten incredibly positive feedback. It's really exciting to work with a group of diverse integrative practitioners around this topic. When I do Migraine 101, I start by showing a clip of a documentary about migraines so that patients can recognize how common this disorder is, and they instantly feel validated by this. I then talk about pathophysiology of migraines, and the questions that the patients have are incredibly sophisticated and thoughtful. There's a sense of relief in the group when I explain what's going on in the brain with a migraine, that it's not just something they're imagining, that in no way, shape, or form is it their fault, and that my colleagues and I want them to feel empowered to take charge of their own care. So we begin by talking about what happens process-wise within the brain, and often I will show graphics and pictures that are quite sophisticated, which I think patients really appreciate. We then spend some time talking about homeostasis, this idea that the more things we can do to keep ourselves healthy, balanced, and have a regular pattern to our life's activities, the better we're all going to feel, but in particular, patients who have migraines. We talk about the importance of sleep, of good nutrition, of stretching, of keeping muscles limber, exercise, overall wellness, and how meditation, craniosacral therapy, and yoga can play a role in this. The patients have an opportunity to ask some questions, which is really exciting for many of them and for me because it's not a medical visit. It's a group setting, and people often feel that they have the ability to ask a question that there might not be time or space for during a routine medical visit. We emphasize that there are many things that people can do in addition to taking medications, and that if someone has migraines, it's never their own fault, but learning the techniques that my colleagues and I talk about are going to be really helpful in terms of going forward. So it's been just a tremendous privilege to work with such terrific practitioners at the Osher Center at Brigham and Women's Hospital, and I look forward to expanding this intervention and offering it to more and more patients. We have now received national acclaim for these sessions, and I expect that we'll continue to do so.
Thank you, Carrie.
That educates our patients about some of the musculoskeletal contributions to migraine headaches and some self-care strategies to mitigate these problems. Our program begins with an overview of posture and spinal anatomy. And what's really nice about the group setting is we can look around the group of 8 to 10 people that we see at a time, and we invariably will have some of the postural faults that we're looking to correct. In fact, most people actually do. And most recognize it, and they really don't understand how they can correct these problems. So we want to give them tools to do so. So we teach the patients about, I call it building a spine. We start out teaching about the different joints and muscles in the neck and some of the ligament structures around the neck and upper back, and also how these tissues can become painful as part of their migraine or as a trigger to migraine headaches as well. And commonly I say it's this neuromusculoskeletal family of problems that triggers your migraine headaches or as part of your migraine headache. So I'll begin by introducing them to, say, the joints of the neck, like the facet joints. And I'll have all the patients palpate their own necks and show them where to locate the facet joints in the neck. And as they're palpating on themselves, most people will start to proclaim that, hey, wait a minute, there's a tender spot there that I didn't even realize it was there. And so I'll have the patients press upon that and stress those joints. And they'll oftentimes say, wait a minute, that's part of my headache. And so we get to teach them that, headaches sometimes really are, it can be partly a pain in the neck and not just a headache as well. And so they start to investigate these different tissues in the neck and upper back and find it on themselves, which is really nice because they get to use that as a metric in the future as well. We then start to discuss some of the muscular and ligamentous structures around the spine, the jaw, and how these structures adapt to the stresses we place on them. Participants then learn how these soft tissue adaptations can develop from repetitive strain or from poor postures, and how these adaptive changes actually hold them into poor postures as well. And they start to understand that, just telling someone to sit up straight and fix their posture doesn't work. That we need to have strategies to reduce strain on these soft tissues and remodel the soft tissues so that they can actually have a more long-standing postural correction. And then we show them how these postural strains can cause soft tissue irritation or joint irritation that can be part of the trigger to the migraine headaches, or the migraine headaches themselves can make these areas painful and tender as well. So we spend a lot of time presenting myofascial trigger points and referred pain and some of the causes that provoke and develop, they're responsible for the development of myofascial trigger points. We have pictures up of all the common myofascial trigger points, and so many patients will say, or so many participants will say, wait a minute, that's my pain pattern right there. And so they can reach across onto their own trapezius muscle and maybe squeeze a tender point and elicit referred pain up into their head. And they start to understand that really there is some of their headache pain is coming from this area or triggered, or the headaches are triggering pain in these areas as well. So they start to understand that there's a reciprocal relationship between the muscles, joints in the neck and upper back, as well as around the jaw, and how that relates to their migraine headaches. So many people will push on a point and say, wait a minute, that's it. That's my headache right there. So it's great to see that they can find these points. And then we need to teach them ways to actually treat them as well. So once they have an understanding of that some of their pain resides in their neck, in their jaw, then we can start to teach them about self-care strategies. So one of the things that we go over is some of the tools that are out in the market today. There are so many tools that are used to treat soft tissue problems and to try to correct posture. And we have a lot of these different instruments and tools and supports that are available for everybody to try out and see, what's really good and what's good for them, because it varies by body type and it varies by person and also by their sensitivity levels. So they get to try products that they can use to do soft tissue treatments on their neck and upper back. And they start to learn, which ones they might want to purchase. And many of them do go out and do it right after the class. And I hear from participants all the time that, I went out and bought my blank device, my Theracane or something, and they use it all the time. So after we go through some of these self-care strategies and how to support their posture as well, then we go over a number of different stretches and exercises that can be used to reduce postural strain and to take away some of the strain on these myofascial structures, and then to have a long-term relief to the strains that they've been placing on their neck and back. So Meredith and I will go around the room and teach patients different postural correction techniques. We'll bring them out in the hallway, have them demonstrate the exercises, and we troubleshoot the exercises with them right there. So in a group setting, what is really nice is that one person can observe some of the limitations of an exercise on another person, and we can show them how to correct it, and they can apply it to themselves as well. We hear back and feedback and follow-up sessions that many people go home and teach people at home, their family, on how to do these exercises as well. And understanding that it's through repetitive exercise and repetitive correction of these postural strains that they're going to get long-term results. In the end, when the program's over, everybody leaves with a packet of material that has a copy of this PowerPoint presentation that we have. It has handouts on how to do the exercises. And then we give them a link to a website that has other postural corrective exercises as well. And many of them will email and give us some feedback on how they're doing with their program. We can send additional exercises and stretches as they need them. And an hour and a half later, everybody has a better understanding of the relationship between their neck, their upper back, and their jaw, and their migraine headaches.
So true, and I thank you, Dr. Kowalski. I feel like it's every group is unique, and it's just a real self-discovery for each patient that's part of the group, and physically, emotionally, really spiritually in a lot of ways. So it's that's a great description. Thank you. G, do you want to go next?
Can you see? Hi. Hi, my name is Keach-Bronstein, and before I present this migraine headache group, I would like to give everyone a little my background view. I was originally trained as physical therapist in France. But when I moved to US 25 years ago, I was also full trained as a physical therapist. Since I practice CST at the Osher Center and fully my private practice, my age of patients between the newborns to maybe 99 years old, and I'll see all kinds of conditions from headache, migraine, concussion to asthma, PTSD, etc. My roots as Chinese, so I'm also interested in Chinese medicine, especially like Chinese reflexology, acupressure work, Chinese Qigong. So I usually integrate all this therapy into my practice according patients tailor their treatment plan. So as joined this wonderful team in our migraine headache workshop, my role there, I would like communicate with our patient, especially two intentions. First, give them a overview of what is physical therapy and how it works, and mostly demonstrated, show them in the clinic setting as physical therapists how we do our assessment treatment to the patient for the migraine headache. Because if you only watch physical therapy, we usually say you are almost like you see the grass grew, you can see anything. But if you feel it, and we usually follow the 3 key points. One, it's a body, it's unit. You are linked head to toe, and the structure and the function is interrelated. If you have really old injury, even maybe decades before, like a horse accident, you sprain your ankles, you may be later on to cause your headache, migraine. So just like them to see any headaches, migraine can from original from different part of your body, and but like we say, we see global, but we treat locally. And the second intention I would like to communicate our patient, educate them, it's to show them some useful acupressure work in their hands, on the feet. They can bring this useful tool at home to relieve their pain. Besides this, some Chinese medical Qigong exercise to keep them like a well-being exercise. And because Dr. Kowalski already did anatomic part and a lot of hang-on exercise, I also teach them exercise. I usually say we play like a yin-yang side, just to show them how this light touch can be really affect their body and then help their symptoms as well. Each workshop, it's a truly fun experience and adventure for everyone, because patients' background, patients' condition are different. So we focus, it's always patients' needs. So we adapt our education, our communication, and exercise to them. And for myself, I learn from our colleagues, and also learn from our patients. They are truly my teachers, and I'm so grateful to be this team and to continue the new adventures.
I love that, Ji. Thank you. I love the adventure part, because it really truly is. And again, all of our patients are they are incredible teachers. Lindsay, your turn.
Hi, I'm Lindsay Keach-Bronstein, and I am an integrative dietitian and health coach, and I facilitate the nutrition portion of our migraine group program. So I typically have 40 to 45 minutes, and my main goals in that short time with our incredible groups is really to foster connection between group members, and I think all of us have this communal goal. To facilitate a conversation around food and nutrition that allows group members to really feel heard and validated in their unique and shared experiences around food and headaches. To teach them some of the foundational foods and eating strategies that can help them to stay well nourished before, during, and after migraines. And to bring some fun into the lesson and engage them with a live cooking demo and tasting so that they leave the session with some concrete ideas and recipes that they can easily make at home and that they've sort of had the experience of tasting. So although I have an outline of topics that get covered in each group, I really want the session to be interactive and based in that group's experience. So I always begin by asking our participants to share, number one, how food impacts their migraines, and then number two, how their migraines impact their food choices. So these questions get at some of the complexity of talking about nutrition and migraines because people have wildly divergent answers to these questions and really different experiences in their bodies. And their answers really illustrate the heterogeneity of people's responses to and challenges around food. So some people have clear food-related migraine triggers. Some of them have a long list of them. Others don't have any food triggers to their migraines or none that they've discovered. Some people have really specific cravings and intense hunger after their headache subsides. Some people experience nausea and have difficulty staying fed and hydrated at all. So most have personal experiences to share and really thoughtful questions to ask. And I really use this foundational conversation to frame the rest of our session. It allows group members to share their knowledge and experience with each other. And it also allows me to make sure that I cover the things that are really of interest for each group. So Dr. Bernstein talks in her session, and she mentioned today about the importance of maintaining homeostasis in the body through maintaining blood sugar balance, staying well hydrated and rested, moving, and bringing in that mindfulness piece. And in my session, we really pick up this thread and dive into some of the specifics of eating for glycemic balance, the components of an anti-inflammatory diet, and strategies for staying well hydrated. These are principles that apply to really everyone, so the majority of our focus in the group is there. We also touch more briefly on supplements and specific migraine triggers, and questions often drive more discussion on these topics, which tend to be more individualized in nature. So I tend to spend, since we have a short period of time, we're really focusing primarily on those influences that can help everybody, kind of no matter what their personal triggers are. But then we're also having a rich conversation about the ways that diet can be individualized and used for each person, and kind of maybe piquing their interest or pointing people in the direction of resources that can help them to dive deeper in their personal journey. A core component, and I think one that everyone loves, of the nutrition session is our live cooking demo and tasting. So this is really a way to lighten up what can often feel like a somewhat overwhelming topic, and to get participants excited about trying new foods and food combinations. We talk a lot about customization of the recipes and different options for modifying them to meet individual preferences and sensitivities. And when we're doing the tasting, I often will go around and have everyone share really candidly what their experience of tasting the smoothie or the power balls or, you know, whatever we're making is. And then we'll talk right then about how, oh, you could add this, you know, to make it better for you, or you could really swap this out since you have a sensitivity to this, so that people really walk away with a sense that they can do this at home. They've tasted it, they know they like it, and if it wasn't their favorite, they know how to change it to make it work for them. So that's really you know, a good look at the nutrition session, and then each participant leaves with a packet of recipes and nutrition tips so that they can, bring all of it home with them. And of course, all of us are there for them as a resource for follow-up questions as they want to dive in deeper.
Wonderful. Thanks, Lindsay. I always love watching people's faces when they watch Lindsay putting cauliflower, kale, all kinds of vegetables into a Vitamix, and voila, it comes out tasting delicious. And I think people's faces, they just can't believe how delicious it is with such, really phytonutrients and all the good stuff that's in there. So thank you. Okay, well, I'd love to open it up to some team discussion. I think, the reason I talked about how many professionals were involved in this when we first started in 2003, just one of the interesting concepts was that for some of us, I'll just speak for myself as an occupational therapist, I was used to working in hospitals very closely with PTs and speech therapists, and depending on what kind of floor I was on, or if it was inpatient or outpatient, there was a lot of collaboration. But for a lot of our colleagues, they were coming from offices or practices where they were pretty much solo, and if not working alone, were working pretty uniquely with their own discipline. So that was a big deal for a lot of people, and for us opening this clinic, we really had this pilot that worked out well, but it was kind of a new world for a lot of people. So does anyone want to talk about what that experience was like?
So for me, joining the Osher Center and being able to work with this talented team was basically like somebody handed me the key to a treasure chest, and I was fortunate enough to find myself in a group of people who were really interested in taking care of patients in a holistic way, valuing every patient for who they were, and also adding their own unique form of treatment modality to general medical care. And I feel like it has just been amazing for my patients as well as me to have access to this team who really jumped into creating these workshops, have come together to refine them, to support each other in the most collegial way, with really the goal of sending patients out with new ideas about how they can be healthier, more well people, feeling respected and heard about their ongoing pain conditions, and with a sense of creativity about what treatment can look like and what wellness can look like. So it's just been really incredible, both to be able to bring patients together for this kind of educational group, and in addition to watch these wonderful colleagues just come together and continually brainstorm about what can we do that would enhance things further.
Thank you. People often ask me, I'm the lucky one, I get to coordinate the groups, and I get to be in every group and hear all of you working with our clients. People ask me what makes it so successful. We usually have a waiting list. Every single group has a long waiting list. And now with COVID, which is a whole different topic we can talk about, we're kind of on pause for the live groups. But I think one of the things that makes it so successful starts with Dr. Bernstein, because you're the one who is referring patients to these groups, and because you have such trusted and deep relationships with your patients, they trust you inherently, implicitly, and when you say this would be a good idea, you should check it out, they sign up. And I think that's one of the reasons all of us work so well together is I think we have this mutual trust in our relationships with each other. And I think that really comes through with our patients. I don't know if anyone has an example they'd like to share, but I think, when we were in the design phase of our multidisciplinary practice, we were dreaming of, when we get to be working next door to each other, literally down the hall, and you can walk by someone's office and say, oh, this is Dr. Kowalski. He's the one I referred you to. I think this will really be helpful.
There's a great headline that came out of this, which was a chiropractor and world-class neurologists work together. which is really, it was the essence of integration when Dr. Bernstein knocked on my door and introduced herself as she came into this clinic, and that her willingness to put aside even professional bias for discussions or collegial discussions on how we can best manage our patients together. That was the key for me. That was the part of the key to moving forward in this group and to moving forward in our patient care. What's really nice in our center is we can consult by walking around. We can talk, we can catch each other in the hallway or on the phone or text each other and catch up. So there's a culture that developed that was really centered around one thing, is how do we get our patients better? And what are the tools that we can bring in? And ultimately, how do we see the patient through the eyes of another practitioner to see if that would be the right person to integrate?
So true. I loved what G said, that she gets to play yin yang with Matt, and it's really true. I think the light touch, the more deep touch. I remember one patient early on when we had just opened came into my office and said, you have to help me figure this out. My acupuncturist is telling me to use heat, and my chiropractor is telling me ice. What am I supposed to do? You know, and I think we have these discussions. We're lucky as a group, we get to come together in team meeting and we get to discuss patients and our approach. And one of the things that really makes, I think, our collective group so successful is that we discuss things as equal members. There's no hierarchy, and I think in a lot of practices, people maybe sometimes don't feel as comfortable bringing up issues or concerns or being equal at the table. And I think that's a big part of what makes our center pretty unique. Does anyone want to speak to that?
I just wanted to say a few words. Since I joined Osher Center for almost very beginning, I think for the last 17 years, what I love the most, and it's really this integrated care and start with ourselves. I think we spend a lot of time to educate each other, to learn each other's each disciplines, what they work, how they work. So get ourselves more integrated understanding, we can expand our practice and offer much more efficient way to explain our patient and collaborate with different disciplines together. And that's, the beauty of this Osher Clinic, I think with this migraine headache workshop, it's really increased our patient's education. It's important, like Meredith say, we don't have a hierarchy between ourselves, but also we don't really have a hierarchy with our patient and the therapists, our doctors. I think it's a really kind of team, build the team to bring this healing happen together. That's what I like to say.
Great. Well, I was just wondering, to kind of close out this part of our session, I would just ask each of you to maybe share one thing that you learned about yourself and your practice from working in this team interprofessional environment.
I was going to share actually an example from today that I think really illustrates the beauty of us all working so closely together. I was meeting with a patient who was referred to me by Dr. Bernstein with migraines, who also sees Dr. Mecki, another amazing chiropractor in our practice. And I work with her around food. You know, food and health coaching is my toolkit. And it's never just about the food, right? I think, and it's never just about the musculoskeletal alignment, and it's rarely just about finding the right medication. And so something in our conversation today triggered me to think about her seeing G as a possibility. She was talking about some jaw tension and some neck things that were happening. And because I've been able to participate in these sessions and work so closely with G, I was able to explain to her what craniosacral therapy is and how G works. And so that having that deep knowledge of how each of my amazing colleagues works, and then knowing that that my patients can find this home with this wraparound care so that they can really attack what's a very complicated chronic health concern from all these different angles. I think that is just such an exceptional and unique situation to be in. And I think my biggest takeaway from doing these groups is just how impactful for the patients, even just these small tastes of these different disciplines. Like, we don't have to solve every problem in this session, but we light a spark for people that allows them to take that next right step forward. And I think that's the process, right? That's the magic, is like, can you just get people to that next right step?
Love that. That is the magic. Thank you. Anyone else?
Definitely learned that there are treatments that I really don't understand that we offer. And I don't need to understand them, really. We have experts that I don't need to understand them to use them right now, because we have experts that are having great outcomes. I'd like to, however, start to investigate those outcomes better. I also start to like to investigate the whys. What are the mechanisms through which these different modalities work and help our patients? And I think we need to take this to the step of trying to do the research that finds out, how does craniosacral therapy work? How does acupuncture work? And what are some of these ingredients that, when we provide them to our patients, that something changes in their physiology? And I'd like to be able to try to measure that.
Love it. G?
I think our Osher clinic, what's the unique way, it's we offer patient almost like new windows for them, for the condition they probably never heard it. They can approach in different way, and to recognize themselves better. Usually my patients say I have a magic hands, but I usually tell them, no, you have a magic body. You just need to the way to awareness with all different discipline approach to see what your body wants you to know, how there can come out from this. And I mean, every day the treatment and to meet the new patient, you can see the eye open with such a wow. I can heal, I can be better. And not really too much by outside magic way, but be understanding and trying some new that already give their hope, and they give them really the new perspective, the life. It's just the healing is not their medical conditions. I think also they're human being, the life changing. I usually say when I see the patient get better, not too much how much pain they go down, you can see their smile. Even sometimes you can see the color, the clothing will be changed. And I remember, especially some artists, they show me their paintings from their very struggle period, their life condition and the pain, and to the way when they get better, their life, the color, the painting spirit is very different. That's, I say, wow, that's something medicine can offer there too.
Beautiful. Thank you.
I guess,
Gary, and
yeah, I just want to say, I think it's a very powerful message for the patients to see the 5 of us working together, and the fact that we all have just so much respect and confidence in each other and the skills that we all, really bring to the care of the patient. They're getting cohesive care. There are 5 people who are concerned about their overall well-being, and seeing how much we trust each other. I think it's really huge for people. And I think at the end of the day, no matter what's wrong or what's right with another human being, they want to be taken care of in the way that we all do. And so this approach of just pulling together these unique treatment strategies and ideas and thoughtfulness in this cohesive way, I think it's huge. And I continue to see these patients. And so I'll hear from people who are in one of the first or second groups. They're still using Lindsay's recipes and techniques they learned from G, and back stretches that they've learned from Dr. Kowalski, and Meredith's breathing ideas and meditations and mindfulness, and they describe them. That's actually more consistent sometimes than medications they might take. And overall, I just think the effect is huge, and it's bi-directional, which is really, just as a physician being part of this, it's amazing.
well, thank you all so much. This was just a great session to be able to share together, and I just feel so lucky to work with all of you and our other colleagues at the Osher Center. We have a really special place. So thank you very much. In our next part of this session, we're going to be able to take questions and answers from people who are attending the forum. So stay tuned for that. And thank you all very much.
Thank you.
Well, hi, everyone. I hope you enjoyed that first part of our session. We loved filming that in advance. We had a short little glitch in technological glitch during Dr. Bernstein's part of the presentation. So we would like to replay that just very briefly so you can hear what she had to say on the panel. And then if you're attending, we'd love to hear from you in the comment section. Please add some some questions for us, and we will be happy to answer them. So thanks a lot. Carolyn Bernstein.
Thank you, Meredith. I'm glad to be here and talk today and tell you a little bit about my part of this wonderful group that we've all worked to put together for our patients. Migraine patients have a profound sense of isolation with a chronic illness that's episodic and incurable. The group brings them together not as a support group, but as an educational process to learn different factors that might help them to be more motivated and in charge of their own health care. And we've gotten incredibly positive feedback. It's really exciting to work with a group of diverse integrative practitioners around this topic. When I do Migraine 101, I start by showing a clip of a documentary about migraines so that patients can recognize how common this disorder is, and they instantly feel validated by this. I then talk about pathophysiology of migraines, and the questions that the patients have are incredibly sophisticated and thoughtful. There's a sense of relief in the group when I explain what's going on in the brain with a migraine, that it's not just something they're imagining, that in no way, shape, or form is it their fault, and that my colleagues and I want them to feel empowered to take charge of their own care. So we begin by talking about what happens process-wise within the brain, and often I will show graphics and pictures that are quite sophisticated, which I think patients really appreciate. We then spend some time talking about homeostasis, this idea that the more things we can do to keep ourselves healthy, balanced, and have a regular pattern to our life's activities, the better we're all going to feel, but in particular, patients who have migraines. We talk about the importance of sleep, of good nutrition, of stretching, of keeping muscles limber, exercise, overall wellness, and how meditation, craniosacral therapy, and yoga can play a role in this. The patients have an opportunity to ask some questions, which is really exciting for many of them and for me because it's not a medical visit. It's a group setting, and people often feel that they have the ability to ask a question that there might not be time or space for during a routine medical visit. We emphasize that there are many things that people can do in addition to taking medications, and that if someone has migraines, it's never their own fault, but learning the techniques that my colleagues and I talk about are going to be really helpful in terms of going forward. So it's been just a tremendous privilege to work with such terrific practitioners at the Osher Center at Brigham and Women's Hospital, and I look forward to expanding this intervention and offering it to more and more patients. We have now received national acclaim for these sessions, and I expect that we'll continue to do so.
Thank you, Carrie. Okay, so we are back, and great to see everyone on the screen. We are back for our question and answer part of this presentation. And we do have a couple of questions popping up, so if it's okay, I'm just going to launch right in. I found it really interesting earlier in the forum. There was a section that Dr. Peter Wayne and Dr. Kreitzer were leading, and it was about implicit bias across providers, how to break down these interdisciplinary barriers. And you know, for us, especially initially when we first came together for that NIH study in 2003, we had 12 weeks where we were just, as a group, kind of breaking down these barriers. We each presented our individual disciplines to the whole group. There was a lot of room for discussion. There were facilitated communication sessions with, you know, experts, and we really got into some fascinating discussions, I would say. Ji, you were part of that. Do you want to share anything about what that was like when we were all learning from each other in those sessions back in Brookline?
Oh, it looks like so long ago, but the memory is still there, very fresh. I think it's so amazing. You know, we come from different background, we'll be able to sit down and listening, learning from each other, and questioning, and not very hold to say anything what the other people will judge me and what I'm doing. And I remember one or two multidiscipline approach for the back pain patient. We different, each one stand up to do our assessment and the plan to think how about in our discipline to do this. And for me, I learn a lot, and I think my colleague too, and even patient. That's really amazing. I mean, I used to work in Paris in the hospital with all my disciplines, but in the reacted, it's very different. We usually just meeting. I think even right now in the regular process. And the second one, I think very, then that early time, we even taste the food. We have a wonderful nutritionist, just like Lindsay, but somebody else. And taste the food, it's really, like I say in the video, the healing is part of life. It's increased not only say doctor office, they can happen in the moment where, you know, we're posture or we're reading or meditation or doing something. So I don't, it's a lot of good memories, and just see our Osher family growing, and patient talk about it. They bring this modality from Osher to their life, and it's a really amazing experience for me.
It's, you know, it's a lot has changed in 17 years since we all first came together. I remember very distinctly the neurologist who was on our team, who he was probably old school even from 2003, very unlike Dr. Bernstein, but I think in the beginning really was skeptical about some of the techniques that we did, specifically craniosacral therapy, acupuncture. But then I believe, became your biggest referrer for headache patients. And, I remember him saying, I don't really know what chi is, and I don't even know if I believe in it, but something about this works. And I think Dr. Kowalski kind of referenced that a little bit too, that sometimes we all understand what we do, but we're at different levels of that understanding. And I think when Dr. Bernstein was just speaking the part that we replayed, it was really, I think she really got to the heart of this. What patients take away from the 5 of us in this one group, all connected and cohesive in presenting this all of these different techniques. They really feel cared for, and that is our main goal. I mean, someone asked in the questions, what's your main goal with this kind of group or this specific group? And it really is to care for our patients. I would love for each of you to talk a little bit about that, what it's like to participate in this group and how patients maybe feel cared for in a different way.
So I think for my patients, or for me, experiencing this with the patients who get to be part of this group, they feel that there's I don't want to say a second level, but an even deeper level of care that they're receiving than just a medical visit. They're being evaluated holistically. They're in a group with other people. But it's not just a support group, it's a learning group. And what they tell me is that they feel that I and that we really respect them as human beings with migraines, and that we want to make a space for them to feel like their concerns are addressed, like they understand what's happening to them, that they learn non-drug, non-medicine ways to be treated. The fact that we're all working together to provide care for them means so much to them. People, the kind of holding nature of these workshops is really important to the patients. And I think it's very unique. And I think, one thing going forward that groups like this can do is try to assess what's the effect of the group itself, of practitioners from different disciplines coming together to treat them, in addition to the techniques that they're learning, the facets that we've talked about with respect to homeostasis, but apart from the different sort of technical pieces, not that nutrition, craniosacral therapy, chiropractic care, meditation, and integrative health coaching is technical per se, but those are the facets that they leave with, the tools that they leave with. But there's something in addition to that really pulls for bringing people together with different amazing skill sets and having them work together and write curriculum in the way that we've done, that I think the patients really value that. And I want to emphasize that.
Thank you. Lindsay, anything to say about that?
Yeah, I agree. With all of what Dr. Bernstein said, I think that patients benefit from both this amazing feeling of support and community, because they're coming together, sharing, similar issues, but maybe manifesting in different ways. And I also think that there's something pretty magical about the fact that there are sort of these sessions that they can come to, and then they can go away and really put these things in practice. And then they come back and they have Meredith as this amazing moderating sort of mother hen. And she checks in with everyone in the group about, okay, we did mindfulness last time. Who tried that? And what was your experience? And so there's a little bit of accountability that comes with it, in putting these new practices into play in their lives, that I think is just sort of an added benefit of it being something that unfolds over the span of time.
Thank you. Yeah, it's really, I do think, we played around with what's the best format for this, and we really we think we're in our happy zone of every other week. So the way that we spaced it out, because people have time to really practice, and it's not a burden to come drive. For some patients come from far away to come and attend our group. So the every other week seems to work really well. While we're talking about that, I mean, one of the questions someone had was, what are our future plans for this? Are we just going to keep, running these groups? And and also, how does COVID affect what we're doing? So we haven't been able to meet in person in a group setting, obviously, for some time since March. Our last group ended in March, but we, as soon as it's safe, would love to start these groups again. And then in addition, we have some ideas about how to, bring back some patients. And as Dr. Bernstein was saying, people really do put into practice these techniques that they learn, and they're excited in the beginning. And then sometimes, as we all do with, I'll speak for myself, with exercise or, the diet or, different changes we make, kind of go off the wagon a little bit. So it's kind of nice to regroup and bring people back with some new topics. So Dr. Bernstein, do you want to talk a little bit about what your patients have told you about coming back or what they've done in practice?
So it's very interesting, now 2 and 3 years into it, I have identified at least a couple of the things that they've learned and continue to practice them and continue to do them, which is just so exciting. And, I think I'm fortunate to work with these creative, talented people. I think that we can figure out a virtual pivot. It may not be multi-session groups and it won't be experiential in the same way, but there are different things I think that we can teach remotely. We're all getting pretty creative about it. If patients, for example, have a list of ingredients in advance of a visit and are able to put things together, or perhaps they get a recipe and it's a show and tell, they do a meditation remotely and learn some yoga poses and stretches. Ji walks them through doing some of the exercises that she's able to teach virtually. I think that there's a way that we can form a connection. It may not be identical to what we did. I was fortunate to be on a call, Zoom visit with Dr. Fauci and some others on Monday, and he said, we are going to get our arms around this pandemic. And I think I loved hearing him say that. And I think a year from now, we will be back to being able to do our live groups in some format. But for right now, this, just like everything that we're all doing, this pulls on our creativity to figure out how to be there for our patients.
I think that's so true. We, everyone's pivoting, and as a group and as a center, we've really come together around what are the safest, best ways for our patients to be seen in our space. And some of us are seeing patients virtually, which is amazing, and patients seem to love that. And then, for the hands-on people, they come in and we've made that safe. So that was a good question that someone asked. Another question someone asked was, how are decisions made about content or which providers are included? So we can speak to that. I think part of it was really just about what kind of, which of our disciplines worked well in a group setting. For instance, it was kind of hard to do hands-on massage, individual treatments into a group setting, or acupuncture even. We did try that in the beginning, but it was difficult with 10 people in the group to really get a handle on that. So the decisions were made as a group, and we really just chose. We have so many talented and brilliant colleagues, and we love everyone to participate. And I think one of our takeaways, which was another question someone asked, but one of our takeaways was we can open this up to have more of our colleagues participate in the virtual space. So I think we'll all look forward to that, and being able to open up some virtual sessions where we can have, our colleague Tom Jacobson do some yoga, or our colleague Arthur Medor do some movement therapy. We have such talent in our space, and it will be really exciting and I think innovative to bring that in a different forum. We are almost at the end of our time. Any last words from our panelists? Anyone? Well, thank you all for attending our session. We really enjoyed putting this together.